Hello, dentist. How are you today? Today we're going to talk about emergency treatments or management in dental clinic for the following conditions: anaphylaxis, hypoglycemia, epileptic, chest pain, acute asthma. Patients coming to the clinic may suffer from certain diseases like diabetes or epilepsy or other diseases. We have to know how to deal with these patients. For example, during dental clinic, patient may get anaphylactic shock, okay, and we have to know how to manage such a patient. So, management of anaphylaxis in dental clinic or anaphylactic shock during dental clinic. The drug we use and give to the patient is adrenaline or epinephrine to reduce your body's allergic response. The dose of this adrenaline is 0.5 milli of one in the ratio of 1 to 1000 micrograms. The route of administration is intramuscular. Also, we can give, this is one type of management. The second type of management, we can give oxygen, which is to help the patient to breathe, okay. Drug used here is oxygen. The dose is 10 to 15 milli per minute. Route of administration is inhalation, okay. So these are the management. This is the management of anaphylactic shock during the clinic. Anaphylactic shock symptoms. Patient, of course, the symptoms. We have to know what are the symptoms of anaphylactic shock: abdominal pain, flushing of face, pallor, rapid or weak pulse. The management: make the patient lie down flat with legs raised, oxygen administration and medical help. Patient with diabetes, okay, especially those with hypoglycemia, most likely problem to be encountered in dental clinic. So hypoglycemia is really very common in the dental clinic. Let's see what are the symptoms: confusion, abnormal behavior, diaphoresis, tachycardia, anxiety, loss of consciousness, seizure. In case of hypoglycemia or patients with diabetes, the dental management is we give the patient a glucose drink, 1 to 2 teaspoonfuls. Route of administration oral, okay. This is one type of management. The second type of management is glucagon, 1 milligram, and it's given intramuscular, okay. So this is in case of hypoglycemia hypoglycemia diabetic patients. Management of hyperglycemia: if hyperglycemia takes place or it happens in the patients with hyperglycemia, let's see what should we do in the dental clinic. Recognize the problem: lack of response to sensory stimulation, discontinue dental treatment, so we have to stop the dental treatment immediately. Activate office emergency team. Put the patient in a supine position and with legs elevated. Assess and perform basic life support as needed. Definitive care: we can give intravenous dextrose and water or normal saline. So 5% dextrose and water or normal saline. Administer oxygen or transport to hospital. This is dental management in case of hyperglycemia. In case of patient coming to the clinic with epilepsy, we might encounter epileptic fit. Okay, so what are we going to do with this patient? We're going to give him midazolam. Dose is 10 milligram, and we give it buccally, okay. And can you see, this is a picture of a patient with epileptic fit in dental clinic. Dental management: most patients with epilepsy know they have the disease and are either on medication or know they are vulnerable to seizure, and this information should be listed during the initial visit. So we have to take a good case history. We have to ask the patient what type of what medication is he on, and if he gets this fit, how many times the fit occurs, and so on. If seizure, when we need medical attention. So a seizure that continues for more than 5 minutes without the patient gaining consciousness between attacks, we call 911. Before breathing difficulties after a seizure, 911. Okay. Persistent confusion or consciousness for more than 5 minutes, we call 911. Injuries sustained during seizure, first seizure, call 911. Seizures in dental office protect from injury. We have to protect from injuries. Dental chair must be in a supine position with raised legs. Do not try to open the mouth, the airway, head to the right side, and neck extended, breath suction. And then we have check vital signs. Chest pain. What are we going to give if patient feels chest pain? There are certain, this is the management of chest pain. We give GTN, and the dose is 2 sprays or 1 tablet. Route of administration sublingual, is given under the tongue. Okay, sublingual. Acute asthma. If a patient with asthma, and then he suffers from his asthma at the dental clinic, what are we going to do? We have to give him salbutamol, 2 puffs, or route of administration is the inhaler. Okay, so it's really important for us to know all the